So one way I do it is simply by asking, conducting, what I call a sexual health assessment rather than a sexual history. Because a lot of, individuals are diverse, have different needs, and so one of the things is simply asking about, who do you feel attracted to, who have you felt attracted to, if you're sexually active, describe your sex partners, and using very open-ended language. And if you find and sometimes patients may not know how to answer these questions or feel a little hesitant, so even simply saying things like, in the past, have you had sex with, or have you had sexual activity or engaged in sexual activity with men, women, both, or transgender individuals? And so simply naming that, provides a reference point to the individual that, oh, I've never heard a provider actually say these things to me or ask me these questions. So that triggers to me that, or triggers to a patient that, you must be open to discussing these topics to whatever degree. And and then maintaining a very non-judgmental attitude. So let's say you're taking a sexual health assessment, for any of our patients, and the individual says, oh, I've had 5 partners in the last year, or I've had 10 partners in the last month. Keeping a very non-judgmental attitude towards it, and not necessarily becoming paternal in the sense of, oh, you shouldn't do that, you're jeopardizing your health, or that's very risky, because all of these things immediately convey judgment, and your patient's going to close down. So if you think about putting yourself in the shoes of your patient, if a provider or a physician or whomever was asking you about your own sexual activity, what kinds of questions would make you feel more open and welcome and wanting to disclose things, and what kinds of words and question frames would make you sort of shut down? And so there's never, there's no one script that's correct, and it depends again, on your speaking style, your rapport with the patient. So just being mindful of not using judgmental language or stigmatizing language, and familiarizing yourself with, terms the patient may be using. The other thing that I also do is revisit sexual health assessments, because when you think about it, the first time you meet a new individual, you're trying to figure out who they are. So if this is the first time a patient is meeting you, they're often trying to gauge who you are, how much they can trust you, do they want to stay with you, do they want to go to another provider, and so they may not be willing to disclose a lot of things that may be stigmatizing, whether it's around sexual health, whether it's substance use, or whether it's even simple things like, are you adherent to your medications? And because people are really afraid of being judged, and no one likes being judged at the end of the day. And so that's another approach. So revisiting on subsequent visits these sort of sensitive areas. And then another thing is simply when a patient mentions a word or something, just simply exploring it with more open-ended questions. So if a patient says, uses some language you're not familiar with, simply saying, oh, I'm not so familiar with that word you used or that phrase you used, can you tell me more about it, in a very non-judgmental way again.